Hello, Sassinari. Thank you for joining me today. So today is the third Wednesday of January और शेड्यूल के हिसाब से ये एपिसोड सोलो होना चाहिए था, बट इट नीड्स टू वेट क्योंकि आज का टॉपिक हम सबके लिए बहुत इंपॉर्टेंट है. कैंसर इज अ स्कैरी वर्ड एंड मोस्ट ऑफ अस फील दैट इट हैपेंस टू अदर पीपल एंड चूज टू स्टे इग्नोर इट. हम ये सोचते हैं कि अगर हम इसके बारे में नहीं सोचेंगे तो ये हमारे पास नहीं आएगा, मुझे तो हो ही नहीं सकता. पर इतनी अवेयरनेस और एजुकेशन का फायदा तभी है जब हम अपने डर से बाहर आए, डिफिकल्ट टॉपिक्स को एड्रेस कर पाएं और अपने लिए बेस्ट डिसीजन ले पाएं. तो जनवरी सर्वाइकल कैंसर अवेयरनेस मंथ है. सो टुडे वी आर टॉकिंग अबाउट दिस डिजीज विद डॉक्टर अरुणा कालरा. Dr. Aruna is Senior Gynaecologist and Obstetrician at CK Birla Hospital, Gurugram. She'll tell us what is cervical cancer, इसके रिस्क फैक्टर्स और सिम्टम्स क्या हैं, सर्वाइकल कैंसर का वैक्सीनेशन लेने का कोई बेनिफिट है भी या नहीं, एंड ऑल्सो डू बॉयज ऑल्सो नीड HPV वैक्सीनेशन. और भी बहुत से सिग्निफिकेंट पॉइंट्स कवर होंगे. सो स्टे विद अस. And before listening to Dr. Aruna Kalra, please follow Little Fixes on your podcast app and share this episode with someone you care about. Hey Sassy Nari, welcome to Little Fixes. This is your host Matri, a social media professional, a mother, and a simple yet sassy woman just like you. Join me for sweet, simple, and practical ideas that help you in transforming into your best self. This mental health and personal growth podcast is a reminder that you matter. And now to our guest. Hi Dr. Aruna, welcome to Little Fixes.
Hi. I'm so pleased to be here, and it's actually honor to address all the public and tell them and make them aware about what actually cervical cancer is, and how can we actually protect our girls and boys from getting infected with papilloma virus, which is the most important causative factor of cervical cancer.
So, doctor, सबसे पहले फिर हमें यही बताइए कि सर्वाइकल कैंसर एक्चुअली होता क्या है, बिकॉज व्हेन आई हियर सर्वाइकल कैंसर आई हैव आल्सो हर्ड द टर्म सर्वाइकल स्पॉन्डिलाइटिस, जो हमारी स्पाइन में या नेक में होता है, तो वो थोड़ा सा कंफ्यूजिंग हो जाता है.
ऐसा ही होता है एक्चुअली. सर्विक्स इज द part of the uterus which is called mouth of the uterus, okay? And the same way cervix is the neck of the spine. Our spine, the neck portion, our spine is also called cervix. So that is why people, as soon as we say cervical cancer, they think that it is the cervical, which is our spine. But cervix is the part of uterus, okay? And cancer of that part of uterus is called cervical cancer. Cervical cancer, as the name suggests, that it is a part of female body, uterus, and that is why it is common or is there in the female. It is a female reproductive organ cancer. Cervix is actually vulnerable because of repeated intercourse. It is in healing process most of the time because of repeated childbirth. Again, every time it gets broken away and then again it heals. So cancer is a reparative process gone wrong. So any structure which is repairing itself, but if repair starts going haywire and excessively body cells starts regenerating itself, that is called cancer. And because this is the organ which is repeatedly getting injured during intercourse and during childbirth and repeated infections, and that is why it is prone for cancer. Because this is the area which we can see with our naked eyes with just a speculum examination. This is the area which actually can be screened very nicely, and we can detect abnormalities very soon and can catch the cancer or we can catch the cancerous cells in pre-cancerous state and treat it. But the sad part is that people are not aware. They do not go for pap smears, and there is not a widespread screening methodology which should be actually applicable in every government hospital. And that is why the incidence is increasing and people are suffering from this kind of cancer.
Okay, so is sexual intercourse the only way to get cervical cancer?
So mostly sexual intercourse, when we do sexual intercourse, we are prone for sexually transmitted diseases. And human papillomavirus is one of the virus which is spread through intercourse. And this is the most important causative factor for cervical cancer. And so not the only, but yes, the most important cause is repeated intercourse, multiple sexual partner, and there are so many other things. When your immunity goes down, like smoking, or people who are having some other kind of immunity deficient, like immunological diseases or other things. And whenever our immunity is low, we are prone to get infected with any kind of virus, and human papillomavirus, because it is most of the time there because of our repeated sexual activities. It starts changing cervical cells and makes us prone for abnormality in cervix.
Okay. So we'll discuss it in more detail in a little while. But before that, I want to understand from you, Dr. Aruna, what are the stats in India for cervical cancer, and maybe a little bit on survival rates as well, if there is data about that.
Okay, so see, because we do not have, as I said, that government-based some study which would tell us the real data about it. But in all reproductive cancers, when we calculate, it is somewhere between 15 to 30%. It contributes to 15 to 30% of all the reproductive cancers in females. And again, because mostly we have rural population or population who does not have access to hospitals or preventive screening methodologies or tests. Survival rate, once we detect the cancer early, it is absolutely curable, because we just have to remove the cervix or uterus and the disease is gone. But if we detect it at a later stages, though we have radiotherapy and chemotherapy and everything, but sometimes it becomes difficult. Prognosis is sometimes really sad.
We talked that there are many risk factors for cervical cancer. When someone gets it, what are the symptoms they experience?
Okay, so symptoms are mostly a lady would be having continuously foul-smelling discharge. Most of the time, when they have intercourse, post-coital bleeding, it would start like after every intercourse, there would be bleeding. It means cervix is unhealthy. There is some kind of lesion or redness, and it starts bleeding. The lady would be having constant lower abdominal pain or heaviness most of the time, because it is inflamed. Cervix is inflamed. And irregular bleeding also they can come with, like in between periods, because again, cervix is unhealthy, it can bleed anytime. So foul smelling discharge is one. Intermenstrual bleeding, post-coital or after intercourse bleeding, a lower abdominal heaviness, repeated urinary tract infections, all these signs, or backache. These are the signs of cervical cancer. So if it has already developed into cancer, or if it is at initial stages of cancer, pre-cancerous condition.
Okay, and who is most at risk of cervical cancer?
So as we were talking just before that, what are the high risks? So people who are having multiple sex partners, who do not use barrier method of contraception, which is condom, and who are more prone for HPV virus infection, they are actually prone, and it can be younger group of females, it can be sex workers if they are not allowed to use, or mostly now previously we used to say early age marriage, but now it is not applicable because we have live-in relationship, we have teenage are sexually active. So younger age group, one age group is which is younger age group, which are more prone because of HPV virus. Another is people who are giving repeated childbirth, like in our rural population, if you are aware that they are forced to give repeated births either because they want a male baby or whatever. So they are also at risk, and people who are whose immune system is really low, whether it's because of some infection or because of autoimmune disease or because they are already going through some kind of chemotherapy or on steroid for some or the other reason, they are also prone for, because their already immunity is weakened, or any kind of virus would start causing trouble.
Okay. So we have discussed risk factors, we have discussed symptoms. Now we'd like to understand some preventive measures which are available for cervical cancer.
Okay, so first and foremost thing would be immunization. So immunization is there against human papillomavirus, and we know that this is the most important causative factor of for cervical cancer. And young boys as well as girls less than 15 years of age, they should go for vaccination. Parents should take them for vaccination, and they just require 2 doses of HPV virus vaccination. In girls, it would protect cervical cancer, and in boys, it would protect oral and penile cancer. And because again and again, we are telling it is sexually transmitted, so boys are also prone for this HPV virus infection. So one is vaccination. Best age is less than 15 years of age. Second best age is less than 26 years of age. Till the age of 45, you can get this HPV virus vaccine, but you should always be getting your pap smear done regularly. So pap smear is one thing, which is a screening test. So as soon as somebody is sexually active, they should go for pap smear yearly. 3 consecutive yearly samples are normal, then they can go after every 3 years. But if somebody is having multiple sex partners or not using barrier method of contraception, we would advise that please go for yearly pap smear test. So how to protect yourself from HPV virus is using barrier method of contraception, having a single partner, and getting human papillomavirus vaccine. Smoking is one of the major causative factors, so stop or quit smoking, which is again good. And if you have any kind of low immunity because of for whatever reason, try to have good diet and exercise schedule so that your immunity is a little boosted up and you are not prone for cervical cancer.
Okay. So if I remember correctly, my daughter's pediatrician said that she will be eligible for this vaccine as soon as she's, I think, 9 years old.
Nine.
Yeah. So I have also seen that most of the parents are scared कि पता नहीं क्या साइड इफेक्ट्स होंगे, क्योंकि फीवर, स्वेलिंग, इस तरीके की चीजें हमने सुनी, और जब छोटे बच्चे पे बात आती है तो वी थिंक अ लॉट मोर. एंड ऑब्वियसली एक और चीज ये भी है कि लोगों को लगता है कि अरे इतना छोटा बच्चा है, सेक्सुअल कांटेक्ट कहाँ से होगा. मतलब इंडिया में एटलीस्ट हमारे दिमाग में ये रहता है कि नहीं, किड्स आर नॉट सेक्सुअली एक्टिव. तो दैट इज ऑल्सो वन ऑफ द थिंग्स. So how do we make people aware, and how do we make them get the vaccine?
I'll tell you one thing. As I started also that, see, we know that cervical cancer is preventable. We know that we can screen it. It's a very, very simple test and very cheap test also. And it's not painful. So if we go for any other screening, whether it's mammography or ultrasound, it is way more costlier than getting pap smear done. But and if we want, if the government wants, we can promote, if we can promote contraceptive, this emergency contraceptive pill, or so many other things like painkillers or toothpastes or antiseptic creams or vaginal washes. And we are doing such good marketing for everything, and every girl knows that what vaginal wash is or what toothpaste they should. So why can't we market that? Why can't we tell them that pap smear is important and human papillomavirus vaccine is available? And what I know that government is also going to get this year, by this year only. And this vaccine would be really cheap. I think 300 or 400
Mm.
rupees only, which is
Uh-huh.
right now costing 3,000 to
Yeah.
10,000
Yeah.
single dose.
Mm-hmm.
So if till that cheap vaccine comes to us, we should like make people aware for pap smear at least. Young girls are open, everybody is open, but they have no idea about it. And as you rightly said, that we are real apprehensive that whether we should give human papillomavirus vaccine to our girls and boys or not. But vaccines are always there. We have chickenpox vaccine, we have rubella vaccine, we have influenza vaccine, and we should not be worried. And if at all you are worried for your girl that okay, at least she should attain her puberty or menstrual cycle, that is also okay, because we don't expect in India that they would be sexually active even before they have started their menses. So we can get once she is 10 or 11, because nowadays girls have started, they are starting menses as early as 10 or 11.
Mm-hmm.
So after they start their menses, you would be a little confident that this vaccine did not cause any harm to her reproductive health.
Mm-hmm.
So, but it is here and it is everywhere in Western country, and by the same name, it is marketed everywhere. Everywhere people are using. I don't think we should be skeptical about it.
Mm-hmm. Okay, okay, understood. And doctor, I have also seen some people say that this vaccine is of no use, like it does not work. अगर आपको होना है HPV तो हो जाएगा. ये vaccine is more like a marketing gimmick. So I'd like to know your thoughts on that as well.
हाँ, सो सी ऐसा होता है कि जैसे हमें फ्लू का वैक्सीन हर साल लगवाना होता है, ठीक है,
हाँ.
क्योंकि उस सीजन में जो फ्लू का वेरिएंट आया है वो नया वैक्सीन उसके लिए आता है। अभी अगर हम ये सोचें कि 10,000 या लाखों तरीके का जो फ्लू का वायरस है, हम उस सभी से प्रोटेक्ट हो गए, तो ये तो नहीं हो सकता। ऐसे
Yeah.
ही एचपीवी वायरस भी तो 100 सैकड़ों तरीके के हैं। सो
Mm-hmm.
उसमें से जो वैक्सीन बना है वो सिर्फ उन्हीं के अगेंस्ट बना है जो ज्यादा प्रोमिनेंटली हमें करते हैं, जो ज्यादा पोटेंट है कैंसर करने के लिए। तो वो 16, 18, वो जो 4, 5 और 9 वेरिएंट है, उनके अगेंस्ट बनाया है वैक्सीन। अब अगर आपको 100 उन 100 में से कोई दूसरे दो हो गए और यू आर बीन अ कैरियर फॉर दैट एंड यू आर नॉट इवन गेटिंग योर पैप स्मेयर डन, तो
Mm-hmm.
कैसे पता चलेगा कि आपको अगर और ये भी होता है कि जब हम एचपीवी वायरस का टेस्ट भी करते हैं पैप स्मेयर के साथ और जान लेते हैं कि आपको किसी तरीके का एचपीवी, यू आर कैरियर ऑफ एचपीवी, एंड बिलीव मी आई हैव सीन सो मेनी पेशेंट्स who are coming regularly to me for yearly pap smear and HPV virus, and now they have crossed their 55 years of age and they have not developed cancer, even with even if when they are carrier of high grade HPV virus. So HPV
Mm-hmm.
virus, even if somebody has contracted, it does not mean that they are going to develop cancer,
Mm-hmm.
but it can be. See, you can be a carrier, and because you actually received HPV virus vaccine later in your life, you might have already contracted that some or
Mm-hmm.
the other virus.
Mm-hmm.
So expecting 100% from any vaccine would not be a logical thing.
Yeah, got it, and it makes sense because जब कोई रेगुलर वैक्सीन है या फिर मे बी चीपर वैक्सीन है उसके साथ ऐसा होता है तो शायद इतना शोर नहीं मचता है, बट व्हेन वी हैव अ मोर स्पेसिफिक वैक्सीन विच इज मे बी लेस पॉपुलर एंड मोर
Hmm.
एक्सपेंसिव ऑल्सो, तो आई थिंक उसमें ज्यादा होता है कि इतना महंगा वैक्सीन लगवाया था बट फिर भी हो गया। तो
Hmm.
आई अंडरस्टैंड कि वेयर दे आर कमिंग फ्रॉम, बट आई ऑल्सो अंडरस्टैंड कि हाउ टू alleviate that misconception as well. So, doctor, now please also tell us the treatment options available or screening, जैसे फर्स्ट स्टेज, थर्ड स्टेज, ये सब भी इसमें होता है और किस तरीके से इसको
हाँ
ट्रीट कर
हाँ।
सकते हैं?
तो देखो, स्क्रीनिंग तो सबसे पहले वही है कि पैप स्मेयर आप कराइए। अगर आपको कुछ भी सिम्टम नहीं है तो भी, जैसे आप अपने ब्लड टेस्ट फट से ऑनलाइन जाते हैं किसी लैब में, टिक करते हैं अच्छा प्रिवेंटिव हेल्थ चेकअप के ये सब टेस्ट हैं, ब्लड टेस्ट, लिवर फंक्शन टेस्ट, लिपिड प्रोफाइल, ऑल दो थिंग्स, यू शुड गो टू a gynecologist, because feminine tests are only three. Breast examination you should know how to do every month after periods. Pap smear you should get every year, and ultrasound for your pelvis you should get every year. So because these are the feminine organs which can cause cancer. And if screening is done, half the work is done. More than half the work is done. 90% work is done. And then if now you have any symptom which might be of cervical cancer or cervical abnormality, आपको डिस्चार्ज हो रहा है, सेक्स के बाद ब्लीडिंग हो रही है, महीना आपका मेनोपॉज हो गया, उसके बाद आपको फिर से ब्लीडिंग शुरू हो गई, पोस्ट मेनोपॉजल ब्लीडिंग, या फिर फाउल स्मेली डिस्चार्ज है, किसी भी सिम्टम के लिए आप डॉक्टर के पास जाते हैं, वो एग्जामिन करते हैं, और उस वक्त आपको लगता है कि उन्हें लगता है कि नहीं, पैप स्मेयर से सिर्फ नहीं होगा, हमें सर्वाइकल बायोप्सी भी लेनी पड़ सकती है, तो उस बायोप्सी के लिए आपको एडमिट करेंगे, बायोप्सी लेंगे, कॉल्पोस्कोपी करेंगे, विच इज अ मशीन जिससे कि हम अबनॉर्मल एरिया देख लेते हैं सर्विक्स पर, और वो भी ओपीडी में ही हो जाता है, और वहां पर कुछ भी ऐसा एरिया दिखता है जो कि अबनॉर्मल है तो हम उसकी बायोप्सी ले लेते हैं. अगर बायोप्सी नॉर्मल आती है तो दैट्स वेरी गुड. अगेन वी वुड कम बैक टू पैप स्मेयर ईयरली. और अगर बायोप्सी में अबनॉर्मेलिटी आती है तो किस स्टेज की अबनॉर्मेलिटी है, क्योंकि वो सिर्फ अबनॉर्मल सेल्स हो सकती हैं, CIN 1, 2, 3, बहुत इनिशियल स्टेज हो सकता है, या फिर बहुत लेट भी हो सकता है. तो इनिशियल स्टेजेस में तो वी कैन एक्चुअली सेव योर यूट्रस ऑल्सो. वी जस्ट टेक cone shape of cervix, remove the abnormal cervix, test the margin of that cervix which we have removed, that it is free of abnormal cells, and that's done. So, but at a later stage, we would want to remove your uterus. Again, if it is actually advanced, after doing MRI, PET scan, and everything, and we feel that it is actually advanced, and removing of uterus, fallopian tubes, and ovaries is advised, followed by radiotherapy and chemotherapy, whichever is applicable according to the biopsy of your cancer.
Mm-hmm. Okay, understood. So thank you so much, doctor, for this very informative session. And now, before I let you go, please let us know how the listeners of my podcast can connect with you.
Okay, so see, I am Director Ops and Gynae Department at CK Birla Hospital in Gurugram, and I'm available all 6 days, 9 to 5 OPD, and even on Sundays on call. I think everybody should, as you said, that everybody should be aware of their preventive health check. Other than blood tests, you should always go for yearly feminine checkup, which is ultrasound for your uterus and ovaries, mammogram, and everybody should learn how to do breast examination every month post period, and pap smear. We are here for any kind of query. You can come, we can discuss face to face, and it would always be good if face to face we discuss, and we can actually discuss many more things other than only cancer, which is a scary thing.
Yeah. Okay, doctor. Thank you so much for being on Little Fixes and for your time.
Thank you very much.
अगर आपको ये एपिसोड वैल्यूएबल लगा तो प्लीज हेल्प लिटिल फिक्सेस रीच मोर पीपल बाय शेयरिंग इट विद समवन यू केयर अबाउट. यू कैन ऑल्सो गिव अस अ शाउट आउट ऑन इंस्टाग्राम. मेरा हैंडल है @littlefixespodcast. दिस हेल्प्स मी इन ग्रोइंग द पॉडकास्ट और बहुत सारे और लोगों की हेल्प भी होती है इसको सुन के. आई एम ग्रेटफुल फॉर योर टाइम. अब मिलते हैं नेक्स्ट वेडनेसडे को. तब तक के लिए खुद से प्यार करते रहो और सदा सैसी रहो. बाय.